First, let's talk about what is going on in Washington and the ripple effect around the country as indeed President Biden signed that stimulus bill and he made comments on it last night. He also, of course, talked about a big vaccine deployment as part of his plan. We've got team coverage of what he talked about last night with our Jessica Smith in Washington and our Anjalee Khemlani, who covers everything coronavirus and healthcare related for us. Jess, let's start with you on this package. People getting checks soon.
Yeah, the White House says the checks could come as soon as this weekend. That was part of the address that President Biden gave last night. This first primetime speech really was somber, but it also was very optimistic because he was saying that there was a light at the end of the tunnel as he acknowledged the challenges that the country has faced over the past year. I'll let Anjalee get into the details of the vaccine goals that he set, but he did say that he hopes to have small gatherings by July 4th and that Independence Day could be the start of our independence from this virus. And a big reason why, he says, is that $1.9 trillion relief package that he signed just hours before he gave that speech. He says Americans will still have to be cautious, but the stimulus checks, the enhanced unemployment benefits, and especially the money for schools and vaccines will help get the country back on track.
If we all do our part, this country will be vaccinated soon. Our economy will be on the mend. Our kids will be back in school. And we'll have proven once again that this country can do anything, hard things, big things, important things.
We will hear more about the implementation of this package later today. President Biden is set to have a ceremony at the White House to celebrate the passage later this afternoon. But let's send it over to Anjalee for more on her take on the last night's speech.
Thanks, Jess. Yeah, he definitely had a very optimistic tone in talking about not betting against America, especially when we talk about the vaccine and the vaccine race, touting the fact that the U.S. has been able to surpass the goal that he had set in terms of reaching that 100 million doses by 100 days, now saying that he could reach that goal well before that in about 70 days. So we're almost there, and the numbers do say that on the CDC's tracker. But we also know that the goal for reaching the general public, we heard previously that the president said that by May 1st, vaccines will be available for all Americans. But now he's also adding that vaccines will be available not just to all Americans by May 1st, but also that the priority groups will open by May 1st. And so that's setting a definite day. So when everyone keeps asking, when will we get those vaccines? We now know the answer to that. So the U.S. should open by May 1st. There are some health experts that have said that by mid-April, they expect that to happen. So we'll see if even that timeline gets pushed as well. Meanwhile, we know that there are, while we have those 3 vaccines already out with Johnson & Johnson, the Pfizer-BioNTech, as well as Moderna vaccine candidates, there are others still in the pipeline that the U.S. is looking at. We know that recently the Biden administration has touted the partnership between Johnson & Johnson and Merck to help produce 100 million more vaccines, really catering to the latter half of the year. And that's because the health experts have warned that, even when we do all get vaccinated, the pandemic is not going to go away. We know that variants are circulating and there may still be need for some vaccines. But looking at that, we got some data out of Novavax yesterday from its phase 3 trial in the UK. And that showed that the vaccine stayed pretty much online with efficacy results from the interim report earlier this year, 96% efficacious against the original strain of the coronavirus. That was a new number, but still staying within that 89 window when including the UK variant B117. So positive news there. We also know that Sanofi is jumping into the mRNA trend. We've seen those 2 vaccines be highly efficacious with a partnership with Translate Bio, and that's starting phase 1. So a lot more still happening, despite the fact that we're looking to have more reopenings by the middle of the year. Julie, back to you.
Just one quick question. We're talking a lot about what's going on here in the United States. Meanwhile, Europe is really struggling with its vaccine deployment. What's the problem sort of here versus other places around the world?
We have a couple of different things going on. First of all, the federal government is hugely involved in the production, supporting the production with the Defense Production Act and leveraging that. So they're able to get these companies, the equipment they need, as well as the supplies they need, raw materials they need, and make sure that they're being prioritized when it comes to this. Meanwhile, in Europe, they've seen some delays in the production. They've also not been using some of the vaccines within certain populations. So it's hard to really categorize specifically because there's so many different countries doing different things. But that is the basics of what is happening there.
All right, our Anjalee, Khemlani, and Jessica Smith, thank you.